Hi, in this video I'm going to be talking about how to work effectively with your medical team. I'm going to describe what a team actually is, how all the team members work together, and how you can be most effective when you show up for your appointments and between appointments. Your medical team involves a lot of different people. You start with being diagnosed. That might be a mammographer who's a radiology specialist. Might be your primary care doctor, your gynecologist, a family medicine doctor, for example. Or you may have been diagnosed by another specialist. You also will see a surgeon, most likely, a medical oncologist, a radiation oncologist, maybe a plastic surgeon, a dietitian, physical therapist. You're going to see nurse practitioners. You might see doctors in training. You might see a physician's assistant. There are a whole host of people that you're going to be taken care of by. Now, when we talk about a team, how are you supposed to coordinate all of this? It seems like there's so many different captains. And who is the captain of your ship? I've been asked that so many times when I meet somebody the first time. As a medical oncologist, a lot of people have already seen a surgeon, heard about a pathologist, maybe seen a radiation oncologist, and then they're coming to see me, a medical oncologist, plus your primary care doctor, who's really important. So the captain of the team kind of changes as you go through different steps. The key thing is, what are the handoffs? Are your team members talking to each other? Why is that so important? Well, if things don't go well, you're going to hear one thing from one doctor and another thing from another doctor. You might hear one thing from a nurse on the phone or somebody in training in one appointment, and this can be super confusing. I think it's really important for you to know it's okay to say, stop, I'm getting mixed messages. Can you guys all figure that out together and then come up with a unified plan for me? Going to a large center where everybody's in the same office doesn't necessarily guarantee that those handoffs are going to feel smooth. Why is that? Well, in part because a new piece of information comes up, and the way we get information now is as a little pop-up on our screen. We don't know if the patient knows this. We don't know if they've called to get an answer from one doctor. So let's say if I don't know if the surgeon has called my patient, the surgeon's in the operating room, I don't want my patient to wait. So I'll give them a call. Turns out they already heard from the surgeon. Can you see how this happens? Well, yeah, it might make sense, but it's still not right? Because you're wondering. So it's totally reasonable to say, who's in charge of my care in different stages? And just be prepared that that might change. I mentioned your primary care doctor. I want to spend a minute talking about your PCP, your primary care doctor, whether it's a gynecologist, internal medicine specialist, or family medicine doctor. It's very common that the family medicine doctor, the primary care doctor, kind of gets out of the loop. They'll get that mammogram report. They won't necessarily get the pathology report. They might get the surgeon's report, but they won't necessarily get the medical oncologist report. It's very important that you let your team know that you want your primary care doctor involved. I have to say, the best care I've seen is when the patient makes sure that we know who their primary care doctor is and that they want that person involved. It's possible you don't. It's possible you were thinking about changing primary care doctors. Totally understandable. But a primary care doctor is not going to reach out to you and call you if they're out of the loop. Now, one of the things I've heard is patients say, I want to switch my primary care doctor because they haven't called me. They know I was diagnosed and they haven't called me. This is actually quite common. And I thought I would explain a little bit about why I think this is. I think it's because once you feel like you're out of the loop, you're worried you're going to do more harm. You don't know what to say. And even though you might be getting some of the documentation, you might think you're getting all of it, you don't want to say the wrong thing. Isn't that funny to think a doctor's worried about saying the wrong thing? We do that all the time. And it only takes us to say the wrong thing once for us to be a little gun shy. So if you can have a little grace towards your primary care doctor, touch base with them, make sure everything's sent to them, and make sure they know what you're going through, because they've known you for longer, right? They know the whole picture, and they'll be taking care of you long-term after that. And if you don't have a primary care doctor, some of the best doctors to help you find one are your breast cancer doctors. Who have they worked with the most that they think is good? Okay, so I've covered what's your team, why have a team, how to ensure smooth handoffs if you can, what the role is of the primary care doctor and why they might seem to back off when you're hoping they actually don't, the last thing I want to cover is how to work most effectively with your team as it is. So whatever your team is, no matter how big or small, whether you like all of them or there's one you don't like as much, even though they're a really good doctor, chemistry just might be there, I wanted to tell you what sort of motivates us to give you the best care in the moment. The first thing is trust. We actually don't really need you to like us. What we need to know is that you trust us. And the downside of not feeling trusted, I'm going to use the first person here, is if I don't feel trusted, I spend a lot of the appointment trying to gain trust. I'm working it to get your trust, either get it back or gain it for the first time. If you think about that, that sounds good, right? I should be working to gain your trust. The problem is the emphasis is not on you and what you need. It's on me. I'm working to get something from you, your trust. So the best way to have your doctor focus on you is to say, I trust you. I value your opinion. Can you let me know why you don't think I need that test? As opposed to, why am I not getting that test? Oh, doctor's on guard now, right? So let us know you trust us, and then ask any question you want. Let's say you want a little more time. You feel really rushed at the next appointment. Start out with, I really trust you, and I value what you have to say. I have a few more questions, and I felt a little rushed. Do you have time for me to ask your expertise? So basically, you're not pushing the doctor away, you're just asking for more, and we love nothing more than to earn your trust. What if you don't trust the doctor? Now, if you've had a long-term relationship and there's a break in trust, that's a big deal. It takes a long time to rebuild trust. If you don't know the doctor and you don't have trust, that's going to be a lot of work for both you and the doctor. I would strongly consider either working with somebody in the office to find a different doctor, or if you're feeling brave, say, I would like to trust you. This is what I need to trust you. It can be really hard work for both you and the clinician to gain your trust back. I know this is heavy. This is a lot to cover, and I think it's the one thing that makes us at our best, and the one thing that a lot of people don't know will get their clinicians to sort of step into the relationship and be more present with you. When you read reviews of doctors, the things that people like is the doctor focused on me. They were fully with me. And I just wanted to share with you what I've learned over the years is a way to evoke that from your team. Again, you shouldn't have to be working that hard, but the doctor shouldn't be working that hard on getting you to trust them. So this is just sort of a quick tip to build trust. Covered a lot. I hope it's helpful. If it is, click like and subscribe, because what that does is it helps other people just like you find it also. And if you want to learn more about your breast cancer treatment options and the tumor that you have or had, visit Yerbba.com for your personalized report.